Ready? Okay, my name is Rafael Santana. I'm a student for nurse practitioner with Maryville University. And today we're going to do the head-to-toe assessment. And our patient today, Arturo, he has agreed to be our patient. Arturo, do you give us permission to do the head-to-toe assessment on you?
Of course.
Okay, thank you very much. And we already did his measurements and his weight. He's 5'7" and he weighs 180. So right now I'm just going to do his vital signs really quick so we can get started with this. And Arturo, let me have your right arm. We're going to check for his blood pressure really quick so we don't waste much time because we only have 30 minutes to do our assessment. And his blood pressure is very normal, 112/68, and that's a very good blood pressure. And I'm going to check his temperature, and I have my thermometer here. And Arturo, I'm just going to do this on your forehead, just like that. 97.5, so that is good. Let me put this over here. And also, I'm gonna check your radial pulse just to get your pulse, Arturo. And your pulse is 82, okay, 84, 82, okay, and we'll do your respirations when we get to your respiratory system. And Arturo, what we're going to do is a head-to-toe assessment, so we're going to start just from the top, going all the way to your feet, okay? So as we do your assessment, I'm also going to do your neurological and your cranial nerves assessment. And I'm going to start just by looking at the features of your head and your face, your hair. Look, that I see you have a lot of hair, and it's very normal of a young guy. There's no balding spots, there's no thinning of the hair. Honestly, I like touching here and just to see that there's no bumps or lesions or any problems with your head, which I think you don't have. And I'm just looking here. And have you had any accidents that you have hit your head in the past? No? Okay. Well, it looks very normal through. So I'm going to look at your eyes too, and I'm just going to assess your eyes right now. And what I'm going to look is just look at the structure of your eyes, look at the color of your sclera, your conjunctiva, and just this also will help us with our cardiovascular assessment to see that there is no deficiencies with anemia or cardiovascular disease or any problem. Okay, so everything looks very normal. Your eyelashes are out. There's no protrusion of the eye, so everything is very good. But third, what I'm going to do right now is do the acuity test to test your vision. And this actually right now is going to do a test for our cranial nerve number 2, which is the optic nerve. Okay, and I'm going to use my phone for my eye chart. So I'm just going to show it that I'm not doing any notes. Okay, and we are supposed to have this at 3 feet away, which is almost the length of my arm. And Arturo, can you read the bottom letters on the chart? Yeah. I'm sorry, Arturo, we're doing this wrong. We have to do it with a cover test. So I'm going to ask you to cover one eye. Okay, and then read the letters right there on the bottom.
D, E, F, P, O, T, E, C.
Perfect. Now, can you cover your other eye? And let's do it again.
D, E, F, P, O, T, E, C.
Perfect. And this gives us a 20/20 vision for his vision. So he has no problems with his vision. So right now, what I'm going to test, Arturo, is your light reflexes for your eyes. And what I'm going to do is just put the light in one eye and look for the constriction on that eye and look for the concentric reaction on the other eye. So I'm going to start with your left eye, and I'm just going to bring the light to your eye, and there's a constriction there. And I'm going to look for the other eye, and there's a concentric too. So I'm going to look now in your right eye to look for the constriction, and then go for the concentric on the other eye, and that's very good. What we're going to do right now is we're going to test for your extraocular movements of your eyes, which also tests for cranial nerves 3, 4, and 6, which help with the lateral movements, with the up and down movements of the eye, and the focus of the eyes. Okay, so what I'm going to do is just want you to look at the pen right here, and it's about 14, 16 inches away. And I just want you to look at the, I don't want you to move your head, just follow with your eyes, okay? Follow with your eyes, perfect. Follow with your eyes, perfect. And what we're testing is the lower and the middle and the bottom fields, okay? Okay, and keep following, and that's perfect. So I want you to keep looking at the pen, Arturo, and I'll keep looking at it. And what I'm looking is for the constriction and the convergence of the eyes, perfect. Okay, so now we're gonna go to the otoscope examination, Arturo. And what we're gonna do right now is look for the vessels and within the eye. And I'm gonna use my right eye with my right hand to assess your right eye. And it's gonna be a little bit uncomfortable, okay? Okay. But just keep looking at the wall. Just keep looking at the wall and try to stay straight, okay? And what I'm gonna do is put my hand here just for stabilization. And there you go. Perfect. We can see all the structures intact and the vessels in the lower and lateral areas. And we're gonna go to the other side too, and do the same thing, Arturo. I'm gonna use my left eye for your left eye. So turn it a little bit more towards me, and just keep looking at the wall. Just keep looking at the wall. I'm gonna bring it here. Perfect. Perfect. Everything looks normal. And that completes our eye examination for the eyes. Any questions? You want to take a little break?
No.
We don't have much time. Okay. Okay. So now we're gonna assess your ears, and what I'm gonna do is just look at the ears, look at the structures of your ears, look for any abnormalities, look for the alignment of your eyes and your ears, and it looks normal to me. So I'm just gonna go there and touch, and to see if there are also any lesions, any bumps, any lumps, anything that will be painful. Nothing painful there.
No.
Okay. So what I'm gonna do right now is what we call the whisper test. So I want you to cover this ear with your finger like that. I'm gonna whisper a word behind your ears, and you tell me what word was that. Okay.
Apple.
Apple. Yes. Perfect. So let's do it on the other side, and I'm gonna say.
Banana.
Banana, yes, and that was good. So what we're gonna do right now is to test your cranial nerve number 8, which is the acoustic, or the vestibulonuclear cranial nerve. It's difficult for me to mention it. Okay, so what we're gonna do is the Weber test, and we're gonna put the fork that produces a sound wave in the top of your head, and I wanna know if you hear it bilaterally the same, or more in one ear than in the other, okay? So, is it about the same in both ears?
The same.
Mm-hmm. Okay. So now we're gonna do the right test, Arturo, and for this test, what we do, we test air conduction and bone conduction, and air conduction is supposed to be twice as longer than bone conduction. So what we do is we start on the right side. I'm gonna put it behind your ear in your mastoid bone, and I want you to tell me when you stop hearing it, okay?
Stop.
Okay, about 7 seconds. So now we're gonna listen to the air conduction and tell me when you stop hearing it, okay? Yeah, and that's pretty accurate. 14 seconds for air conduction and 7 seconds for bone conduction. So let's test the right side and do the same thing. That's all about 7 seconds too. And let's do the air conduction. Done. Okay, so that's about 13, 14 seconds too. And that's very normal, so you have no problems with your hearing. And So what we're gonna do is now look at the structures inside your ear. And something I forgot about the eye exam, I didn't do the cover test. And here what I'm gonna test before I go into checking into your ear. I want you to cover one eye, and well, with this hand cover this eye. Don't put it too close, just like that. I want you to look at the pen. And when you uncover it, I want you with both eyes to look at the pen. Okay, and what we see here is assessing for lateral movements. Obviously, you don't have lateral movements, so that's no problem. Let's do the other eye with the other hand and move it to the side. When you uncover it, just keep looking at the pen right here. Uncover it. And perfect, okay. And that's something I just forgot on my eye exam that I was thinking. Okay, but pretty much your eyes are pretty good, very good vision too. So now we're gonna look inside the structures of your ear with a ophthalmoscope, and so it's gonna be maybe a little bit uncomfortable, but I'll make sure that I don't hurt you. Okay, so I'm gonna start with your right ear. And what I look in here is for the structure, the ear canal, and also for your tympanic membranes, that everything's intact and there's no problem with it. And I use my hand for balance. I don't tremble a lot. But I'm gonna pull on your ear just a little bit, okay? And perfect. Cool. I can see the ear canal. The structures are clean, and your membranes are intact and they're liquid in color. Perfect. I'm gonna do the same on the other side. Okay, and I use the same hand because this is my stable hand. So I'm gonna pull with my left hand your ear to the back a little bit, okay? And again. Okay. And you can see the ear canal well, and everything is very clean, and the structures are well, and the membranes are intact too. Perfect, I thought. Let me throw this away. Okay, so now we're gonna go to assess your nose structures, and I'm just gonna touch for your sinuses and that everything is normal here. No pain here in your nose, nothing.
No.
Have you had any fractures, any accidents? No.
No.
Let me assess your temporomandibular joint. I want you to open your mouth. Okay, and can you close your teeth? Oh, okay. Can you? Oh, okay. And here we're assessing for other cranial nerves as well. So what I'm going to do here is just to look at the septum, the fossa, and the turbinates of your nose on each side, and just expect that they will be normal, okay? And move your hand a little bit to like that, just right there. And yeah, you can see turbinates are swollen, but that is normal. And everything's pink in color, and on the other side, also your turbinates look swollen, and everything is pink inside, and it's very normal too. Okay, so now we're gonna do your mouth examination, and for that I'm gonna use a tongue blade. Let me just get it right here. I'm gonna use a tongue blade, and what I want you to do is, right now you're just gonna see your lips, and obviously they look normal. And also when I assess here, I assess also for some symptoms that could reveal some anemia or cyanosis or problems with respiratory conditions or even with cardiac conditions. So I just keep your teeth like that. Just relax your mouth, just so I can look at your gums inside. Okay, can you open your mouth and leave your tongue? Okay, that's very nice, pink in color. Can you open your mouth and let me see the upper and lower soft and hard palate? And now can you stick your tongue and like that? And that is actually cranial nerve number 12, which is the hypoglossal muscle. Okay, and that's the one that controls the lateral movements of the tongue. So can you put your tongue in the inside so I can look at the size of your cheeks, and we won't assess this size because here is where most of the cancers develop. But if you're not a smoker, you shouldn't have any worries about that. Okay, and now I want you to stick your tongue, and I'm gonna push your tongue down to assess your cranial nerves 9 and 10, which are the I think I always have hard time with the names. The vagus and glossopharyngeal. Okay, and I want you to do a like a gag reflex, do like when I push down to help me see the vulva and the posterior pharynx. Okay, and just leave your okay. Oh, okay, perfect. Everything is normal in there. Great. Let me throw this away. Okay, Arturo, so now we're gonna do assess your neck, assess your nodes, your lymph nodes on the neck, and for that I'm gonna do a little bit of palpation. So I'm gonna start with the cervical area and just touch here a little bit. And what I'm looking for is just for any masses, for any lymph nodes that may be there. Looking at your cervical area, that everything will be very normal. So I'm going to look at pre-auricular areas, and just also do some palpation here. The post-auricular, and there's no lymph nodes here. The submandibular, submental, and the posterior anterior cervical change, which is along your sternocleidomastoid muscle. Okay, and I'm going to assess your tonsillar area also too. And to your supraclavicular, just gonna cover you just a little bit. What I'm looking is just like for lymph nodes, swelling, or any abnormalities, and obviously you have none of that. I'm gonna assess for your thyroid, and usually your thyroid is below, right there below your Adam's apple, and you could feel it right here. But most of the times you cannot feel the thyroid unless there's any problems or swelling with the thyroid. So I'm just feeling right here. Okay, I'm gonna assess your carotid arteries. I'm gonna do just one at a time, okay? Because we don't want to block circulation to your brain and have you faint on video. Okay, so on this side. Okay, good pulses. So I'm gonna listen to them with a stethoscope, and in this case we use the belt of the stethoscope, and I'm also gonna listen to your thyroid gland. Okay, so I'm gonna listen to your carotid arteries first. With positive 1 pulses. And perfect. And now I'm just gonna listen here to the thyroid, and let me find your Adam's apple, and just right here. Okay, and that looks normal. What I'm gonna do now is assess your axillary and supraclavicular lymph nodes. So I need you to uncover your crown a little bit. Okay, so I need you to lift this arm. So this is what I'm going to do, start assessing these areas right here to look for the axillary and subclavicular, infraclavicular also. And there's no nodes here. We look to the posterior area. Okay, and then to the middle area here to the arm. And just assessing that there's no swelling. Let me do the same on the other arm, and let me start by that. Okay, let me do the axillary anterior. Let me see the axillary, I'm sorry, that's fine, you can rest your arm on my shoulder. Axillary posterior. And the middle part to the arm. Okay, that's good for the nose. So no, you're very normal, Arturo. cover yourself. What we're gonna do now is assess your upper extremities. Okay, so what we're gonna do is do some range of motion for your upper extremities and make sure there's no problems with them. As I'm doing that, I'm also assessing your skin, and I know your skin is very even in color. I don't see any abnormalities, any lesions. You're young, so I can see that you have small pimples that you have here and maybe some on the back, but that is almost probably for your age, which is what, 21, 22? 24 years old. I wish I was 24. So I'm going to start with your hands, and I just want you to open and close your hands and then do dorsal extension, okay? And can you move your fingers? And can you touch one finger at a time with your, and there you go, like that. And here we're just assessing coordination and movement, okay? Put your hands against mine and push. Okay, so there's good strength in there. So now let's do some flexion with your biceps and extension. Okay, do it again. So now pull my hands towards you with resistance. Okay, now push them towards me. Okay, it is actually more assessing the tricep. I want you to do lateral movements with your hands for your shoulders, and just bring them up and down. Okay, can you bring both hands really like this, put them behind your back? I'm just assessing the movement of your shoulders. Can you put one hand on the back and the other one on the back like that? Okay, no pain in there. Okay, do the other side. Okay, perfect. And I'm just gonna do one more assessment for the rotator cuff, and I learned this as a personal trainer. And I just want you to put your shoulder like that, and this is like, I'm just gonna rotate your hand like this. Tell me if you feel any pain. No pain whatsoever. And this will, anyone who does this movement and has pain basically has a problem with the rotator cuff. Okay, so now we're gonna do it again like this, and like this, and, oh, okay, so there's no problems with your shoulder. Let me just assess your radial pulses. And this is also part of the cardiovascular assessment that we're doing, but it's as we get into the cardiovascular. Good pulses here, and we're going to assess your brachial pulses too. Good. So now we're going to go into the respiratory assessment, followed by the cardiovascular assessment. So right now I need you to uncover yourself a little bit again. And what I'm going to do is just look at your chest, look at your back. Just breathe normal. I'm looking for your normal breathing patterns, your chest expansion and excursion, and just to see if there's no any abnormalities. And I'm just going to do a light palpation here in your back. I don't see any problems right now. So I want you to turn to this side so I can go to that side, Arturo. What I'm going to assess right now is symmetrical expansion of the lungs. So I want to put my hands right here, and I want you to take deep breaths. Again. And we can see that the tongues are pulled away from the center of the area, like for, again, about almost like 3 to 5 centimeters. So I want you to turn to this side, Arturo, because I'm going to do the same in the front. Okay, and this is thoracic expansion right here of the lungs, and you know, males have more abdominal expansion, females have more thoracic expansion. So it will be normal to see more expansion in this front part of the area. So right here. Okay, let's do it again. Okay. Okay, and you can see that your abdominal area expands more than your thoracic area, and that is normal too. So what we're gonna do is turn you again to this side, Yes, I'm gonna do what we call tactile firmitis, and I want you to say the number 99. And what I'm assessing here is the vibrations of the lungs through the fields of the lungs. Okay, so just say 99.
99.
99.
99. 99.
Okay.
99.
Oh, okay, perfect. That's fine. Stay like that. I'm gonna do the same on the front of the chest. So say 99 again.
99.
Okay.
99. 90.
Okay. Right. Okay.
99.
Okay.
99.
Okay, that's normal. So stay in that area because I'm gonna do percussion right now. And I'm gonna start from the left side to the right side, and what I'm gonna do is percuss all the areas of your back. Okay. So. This is just normal. And what we want to hear is resonance. When you hear dullness, usually it's an organ, or if it's in the lungs, it might mean fluid retention or some kind of respiratory problem. So what I'm going to measure right now that you're like this, I'm going to measure diaphragmatic excursion, and that is the difference between the right side and the left side, because on the diaphragmatic expansion. So what I want you to do is just put your hands like this, like right there, and I want you to take a deep breath and hold it. Okay, right. And I'm going from dullness to resonance. I'm sorry, from resonance to dullness. I'm gonna mark this point right here. Okay, I have a pen with me. I'm gonna mark that point right there. Okay, so I'm gonna do the same. Now I want you to take another deep breath. Oh, did you let it go? Okay, no, you can breathe, I'm sorry. Okay, now I'm going from dullness to resonance. Oh, okay, and that's about right there. Breathe, you can relax. You can relax. You're gonna be in shape by the time we finish this assessment, Arturo. I'm gonna do the same on the left side. So take a deep breath. And we can feel the dullness right here. Okay. And take a breath, take a breath. Oh, relax, relax, relax. Take 2 or 3 deep breaths. Okay, I want you to take another deep breath. I'm gonna go back. Go. Okay. And okay, you can relax now. And I'm gonna measure that. And your diaphragmatic excretion is about, let me see, get centimeters. 5 to 9. It's about 4. And yeah, it's about 4 on the same, and it's okay for the right side. The right side is about 1 inch higher than the left side, but that is normal because of the kidneys. Okay, I want you to stay like that, Arturo. What I'm gonna do is auscultation now of your lungs, and I want you to keep your arms bent like that, bend a little bit the head down, and I want you to take regular breaths. Don't do it fast, but just take them as brief as possible. Okay, go. Okay. And what we're looking for here, if a person had CHF, you will listen for fluid irritation, will be like crackles and rails, and with a asthmatic patient, probably hear some wheezing on the bronchiovesicular and bronchial areas of the lungs. I want you to raise your hands high like that, and I want you to take deep breaths again, and just 2 times on each side. Go. And good. You can bring down your arms and then clear. Turn to the side of the room, please. And now we're gonna listen to your bronchial area of the chest, which are the bronchiovesicular and the vesicular sounds of your lungs. Okay. So I'm gonna start in your bronchial area. Just breathe normal and deep. Perfect. Good, and your lungs are clear. And that concludes our. That's good, right? And that concludes our part of the respiratory. So we're gonna continue with our cardiovascular. So I'm gonna ask you to lay down a little bit, okay? And I don't know if you can come with the camera a little bit, so you can put it right here. And what I'm gonna do right now is I'm just gonna look at your chest and look at your breathing and look for any heaves or for any pulsations in your chest area, and I'm gonna palpate the chest area with the tricuspid area, and also just trying to feel for any thrills, heaves, or pulsations. Pulmonic area. Okay, and looks normal, Arturo. So feels normal. So now I'm gonna listen to your cardiovascular sound. So I'm going to start by your pulmonic, your aortic, and we're going to go down to the Hertz point, which is in the third intercostal space, then to the tricuspid area, which is the fifth intercostal space on the ventrolateral area, and then to the mitral area, which is on the fifth intercostal space, mid-clavicular line, and also, I'm gonna find out right now first your apex, which is your point of maximal impulse, which is mid-clavicular in the between the fourth and the fifth intercostal space, right here. I'm just gonna see if I can feel your heart, okay? And I can actually feel your heart. If I would not be able to feel your heart, I will turn you to the left side, because that will bring your apex closest to the chest, and but I can actually feel your pulsations right here. So let's listen to your heart sounds, okay? And here at the Herb's point, that's in the third intercostal space, sternal area, that's where the S2 of the heart is heard the strongest also. So I can hear very strong right here. You don't have much body fat, so I mean, it gives me very good sounds. Good normal sounds, Arturo. Okay, you can sit down, Arturo. No, stay like that, because I'm about to finish your cardiovascular assessment. But I'm just going to look at your feet, and I'm just going to look at your legs and your feet for color and for hair distribution, which also gives us signs of problems with circulation or cyanosis. Obviously, you don't have peripheral vascular disease or any problems like that, any swelling, any edema, so there's no problems with that. So I'm going to assess for your dorsalis pedis pulses. Just relax. And also, and they're like +2, very easy to palpate, easy to feel. I'll go for your tibial pulses here. And they're also easy to palpate and feel. And I'm just going to bend your knees a little bit, right there. I feel your popliteal pulses right here. And they're very palpable also on both sides. And your nails are in very good color, and obviously you have very good capillary refill, which I should have assessed when I did your extremis, but it's less than 1 second, so there's no problems with that. Okay, you can sit down there too. Well, now we're gonna do an assessment of the abdomen. So I'm sorry, I'm gonna lay it down again. So I'm gonna assess your abdomen. I'm gonna ask you to bring your shoulders a little bit down if you can, more to the pelvic area. Don't worry about it. Okay. Right now I'm just gonna look at your abdomen. I'm just gonna see the movements, and what I'm gonna do is auscultate before anything, because if we do any movement or touching or percussion or palpation, that might make your bowel movements more hyperactive. So I'm gonna start assessing all the quadrants of your stomach, and I'm gonna start with the right lower quadrant. That's where the sounds are the strongest. You had a good lunch? Yes.
Very good.
Okay, so I'm going to listen to your arteries. I'm going to listen to the aortic artery right here in your stomach, okay? And that is done with the valvular stethoscope too. Let me see. Okay, I just relax you. Okay, so I'm going to listen to the renal arteries, yes, on each side. I'm listening to the iliac, which are right here. And I will listen to the femoral on both sides, which are more like right here, Arturo. That's okay. If you don't want to uncover yourself, I'm just gonna, it should be like something right here. I probably won't hear it because of your shorts, but they will be palpable more like right here in these areas. Okay, so that's okay for that. So now I'm gonna do recurse your stomach. Okay. And here where you hear more dullness, that's probably where your liver is, okay? And more resonance will be here over your stomach. Okay, so I'm gonna measure that where your liver actually is, okay? That's about right here. and it's probably about 6 centimeters, so you can hear the dullness and the difference to the resonance where you hear right here. So I'm going to do a little bit of light palpation, okay? Light palpation on your stomach, just to see the movements of the stomach. Is anything of this uncomfortable?
No.
No? Okay. Now I'm going to do a more deep palpation, okay? Just trying to feel the stomach, the organs. No problems? Okay, so I'm going to try to palpate your liver. So I'm going to bring my hand down here, that's okay. And I'm just going to put a little bit of pressure right here. And that mass that I feel right there, that should be your liver right there. I could try to feel your gallbladder too, but if it's not swollen, usually it won't be felt. And I'm going to try to feel your spleen right here at the 9th and 11th intercostal space to the inner side of the stomach. And also with the spleen, if it's not swollen and there's any problems with it, you will not feel the spleen, which is normal. Okay, so I'm going to try to feel your kidneys, and this is right here, and not just relax, and I'm just going to push you a little bit, and push with the hand on the bottom, and that's where the kidney should be. And I'm going to try the other side. Okay. Okay, that's fine. So now, last I'm going to look for the aortic pulsations, and that's next to the umbilical, always about 1 or 2 inches above. So I'm going to just and right there I can feel the pulsations, and that is good. Okay, Arturo, you can sit down and cover. That covers our assessment of the stomach. Next we're going to do our musculoskeletal assessment and assessment of more of the lower extremities. Okay, so first I'm going to do your tendon reflexes, and let me get my feel. And okay, so what I'm going to start with a brachial reflex, and that is okay right here. And okay, right there. There you go. Okay, that's movement. Then we do the other arm. The other arm, and it will be like right here. Okay. Oh, okay, good. Okay. Now I'm going to say your knee reflexes, and I just wanted to, I'm sorry, into your radial reflexes, and that'll be just like right here. Okay. Okay, now we're gonna do your knee reflexes too. Just relax your legs, and we're gonna hope we get some movement in there. Okay. Okay, good. Good reflexes. And that's with the other side. And just let it hang. You did that on purpose? No? Okay, my bad. I did it too strong. Okay, I'll do the Achilles reflex too. Okay, so this is here in the back. Okay, so just relax your leg. Okay, and okay, I don't want to do it too strong. Just relax your leg and. Okay, perfect. Now I want you to do some leg extensions from your knees. Just extend your legs as high as you can. Okay, and bring them down. Okay, I'm gonna assess the strength of your legs. Bring them up. Okay, now bring them down. Oh, okay, good strength. Now I want you to open your legs. Okay, open your legs as much as you can. Close them as much as you can. I'm assessing some hip flexion and there also. Abduction and adduction. So I want to see the strength. Now open your legs so I can. Okay, now try to close them. Okay, so we have good strength in there. I want you to stand, Arturo. Stand here. And can you open your legs just a little bit and make sure you're not too close to the bed. And just do like a mild squat as low as you can. Okay, try to keep your feet as flat as possible. Do it again. You don't have to go very deep. That's fine. That's fine. No pain in your knees or your joints. Okay, now let me assess your back. Turn it around. And what I'm looking here is just for any abnormalities. Again, I'm just gonna do a light palpation going from the cervical spine all the way down to the lumbar spine, and I'm just gonna go space by space, trying to feel any lumps or abnormalities, any problems that may indicate. Have you had any back pain? No, no problems with your back.
No.
Okay, so I want you to bend down like that. Turn around like right here, right there, and bend down as much as right there. So it gives me another chance to assess your spine, and also look that your shoulders look even. And well, we assess here for scoliosis, and also there's no problems with your spine. Stand up. So we're gonna do this just. I want you to turn to one side and assess the flexibility. Okay, turn to the other side. To the other side. Okay, so no problems with that also. Okay, and okay, have a seat, Arturo. Well, that pretty much concludes our assessment, and I think you're a very healthy individual. And well, thank you very much. This is my assessment for head to toe. I hope I didn't forget much. Thank you. Yes, cut.